Welcome to the funnel effect. This is the brief on the current OASIS 7 trial. Back in September 2010, the New England Journal of Medicine published a massive study by the current OASIS 7 investigators. They looked at over 25,000 patients with acute coronary syndromes, basically severe heart issues like heart attacks. The goal? To see if doubling the dose of blood thinners, specifically Clopidogrel and Aspirin, leads to better outcomes. You know, in medicine, we often think more is better. But does adding extra blood thinner just create a leaky plumbing system without actually clearing the pipes? First, doubling the Clopidogrel dose for 7 days didn't actually reduce the overall rate of cardiovascular deaths, heart attacks, or strokes at 30 days. It actually just increased the risk of major bleeding. So on the surface, this kind of looks like a completely failed experiment, right? Well, second, here's the plot twist. For the subgroup of patients who underwent PCI, meaning they actually had a stent put in, that double dose of Clopidogrel was highly effective at reducing stent thrombosis, which is when dangerous blood clots form inside the new stent. So now that we know the nuances of the first drug, what about the everyday household drug used in the trial? Finally, the aspirin results. Pumping patients with a higher 300 to 325 milligram dose showed absolutely no significant benefit over a standard 75 to 100 milligram low dose for preventing major cardiovascular events, and there was zero difference in major bleeding. The lower dose is literally just as effective. So, standard doses of Clopidogrel and low-dose aspirin are generally sufficient for acute coronary syndromes, though high-dose Clopidogrel offers specific clot-preventing benefits for patients getting a stent. Thank you for watching The Funnel Effect.